Hi guys, my name is Jessica Bustamante and I'm back with another video. I am here in Denver, Colorado with my friend Mike Nelson, and we are talking about medical cannabis and what it does for patients. This is a topic that I've been very passionate about, that is very difficult being that I was in Texas and couldn't really speak freely about the medicinal parts of cannabis. And not just for cancer patients, but patients in a whole. That's talking maybe anxiety, depression, epilepsy, rheumatoid arthritis, you name it. There are many reasons why I am pro-cannabis. Now, when I speak to patients, it's not all, when you hear the word cannabis, I know there's a stigma of, getting high or just THC. There are many different, I want to say, regimens to cannabis. There's CBD, THC, and you could even do half and half, depending on your prognosis. In fact, there's even topicals. I use topicals to help with my joint pain. I've gotten together here with my friend Mike to talk about, I want to say, all the reasons why I am for, cannabis. But we need to educate people on what it actually does for the body and open your minds to what it could do for other people who really need it. It's not harming my body in any shape or form. It is a natural plant, but there's a lot of stigma behind it. Being that I'm in Denver, Colorado, I can speak freely because thankfully I'm in a legal state. So we're talking about patients, we're talking about cannabis, and I just really wanted to get this on camera.
Yeah.
Mike Nelson has been dealing for many years with different types of patients, and he helps people learn what medications would be right for them. So, I just wanted to explain a little bit before I go any further. You wanna?
Well, to define the recreational use, I think is an unfortunate situation that developed here in Colorado and stigmatized everybody who was doing it before. What's interesting about you is you weren't regularly getting high and
No.
partying, at least with
No.
weed.
In fact, I was a mother that taught my children no drugs. And when I found out in 2014 that I had cancer, and over again, when I was researching what could I do for myself to help my immune system, cannabis kept popping up. And I went through a guilt trip as a mother, thinking, I can't do this. I taught my kids no. And yet, here I am gonna do something that I completely was against. And yet, I was only given a year to live back in 2014. 7 years later, almost, I'm still here today. Now, I'm not gonna say, is cannabis the cure? You know what? It has worked for patients that I personally know to be a cure. However, in my case, I believe that cannabis has helped me have the fighting chance to be here today. Am I still fighting? I am. It's part of one of many things that I do.
Well, excellent. And I brought these. I'm going to set this here. Maybe now's a good time to throw this out here.
Okay.
That is crude extracted from alcohol.
Okay.
Remove the alcohol and take this tar, which is this right here. So this much darker. This is crude extracted from CO2
Wow.
and rather than ethanol, so it lacks the ethanol. And then this is still the distillate product that goes through a short path distillation like moonshine.
Okay,
And,
gotcha.
and it vaporizes and it recondenses into the soil. So that's where the purification part of it comes. It still can carry with it if there's tainted material to begin with. So the nice thing about the whole hemp and cannabis movement is it's really now legally required to have heavy metals testing,
Right.
to meet pesticide standards and all, and these type of things, whereas before it was a wild, wild west.
Right.
Well, all the original guys were adamant about the quality and the above everything else in the way that they produced it, but once legalization came in, there was a lot of people who just needed to make money, and at the end of the day they would contaminate their crops with their lack of education in what and how to apply and when and all these other things. So it can still be a very dangerous thing. It's not because the medicine is dangerous, but because of the other same chemicals that are going on in farming and agriculture. Some guy doesn't want to lose his crop, so is he willing to risk putting something on it?
Right.
Of course they are.
Right.
You know?
Wow.
And so
Wow.
these two products are really the heart of the whole thing. This is full spectrum and this is partial spectrum.
Right.
And these can be isolated into higher quantities of THC or CBD and CBG and all the other cannabinoids and
And what's
terpenes,
interesting about this, that Mike's going over this, because in 2016, I started hormonal therapy with one of my doctors. And what was interesting about this is that they checked my blood levels. And at the time, I was on, again, I didn't know much. I was making my own medicine. So I was using high quantities of THC. We found out that high quantities of THC converts testosterone into estrogen. Because I'm hormone positive, they had me have a hysterectomy, they took out my ovaries, and I cannot have estrogen in the body. So my doctor inserts testosterone pellets into my body that last about every 5 months, and it is full force, strongest level of testosterone for the body. And that was to help strengthen my body. That was to help me have a normal relationship with my partner. Because most people going through cancer don't have a sexual life. They don't. Because of their body being torn down because of all the chemicals that they're ingesting. When you feel sick, you don't really want to do anything. So this changed everything. But what we found out in my blood is that because I was on high quantities of THC, it was converting testosterone to estrogen.
that's interesting.
This is why I had to tweak my medicine to higher quantities of CBD. So if you're a cancer patient with hormonal cancer like myself, you want more quantities of CBD. If you are a person with non-hormonal cancer, then higher quantities of THC would be the better regimen for you.
Yeah, and there's also the ingestion of CBDA before it's decarboxylated, which is the conversion, and now the conversion of CBD into delta 8,
Wow,
which is one step away from delta 9.
wow.
And so it's been reported, I haven't tried it, I'm about to make some,
Okay,
but that the kind of euphoric and or paranoia that's attached to the delta 9 cannabis that a lot of people feel, I think is what stops most people in the beginning. They get freaked out and
yeah,
they go, well, you know, I wanted to go to the hospital, and they never do it again.
right,
Well, you know, that is that's what would be considered an overdose. If you
Right.
get too much of something that's good for you.
Gotcha.
And a lot of people are confused, I think, too, about the smoking of it. And
Yes.
say, well, it's just like cigarettes, I'm going to get lung cancer. Well, it's just
No.
the opposite.
No.
But
Yes.
that thought process is there that, oh, some combusted material can only result in a form of cancer.
Right.
And
Right. And again, it's lack of education. In fact, I'm talking to you on cancer because I'm a cancer patient. But I'm going to ask Mike, he deals with many patients, not just cancer. So the patients you do deal with, just to give an idea, what type of diagnosis do they come with that this helps?
Well, many and several. So cannabis was the #1 medicine for thousands of years for any type of inflammatory. So arthritis, prostate, inflammation in the joints in the body that causes other problems, because now your immune systems and your white cells are they have to work, and they can't be spending their time dealing with other things. So for those simple reasons, and when you look at the biology of a cell itself and how it has to interact with its own functions and the transfer of nutrients and material from one cell to another, here is in essence, a mechanism that enhances every part of the body, from bone to cardiovascular to muscular, skeletal, and even the mental.
Right.
Right? So even your psychology
Right.
is affected, and not everybody in the most positive way, but that could be a variation of all these things that are now just, and they aren't now just being tested. The United States government has over 150 patents on the medical use
Right.
of marijuana, and they've had those since the 70s.
And what's funny is that that's true. The government has a patent, but they're the ones also coming out trying to legalize using synthetic
Oh,
stuff. Like Mike was saying, we go back to our meats, what we're feeding our animals, why it's not good for the body anymore, and what has happened. We go back to why you need to understand why organic is the way to go. It was natural medicine, just like nutrition, and
Yeah.
what it does for the body. So, in my case, yes, I have cancer, but like I told Mike, when you're given a terminal diagnosis, most patients, you can't imagine the anxiety, the depression, the insomnia one goes through. So if you even think of just to sleep, to get rest, these things help my body get the rest that I need, heal, medicinal healing for the body. I told Mike I use topicals for joint pain, and I deal with side effects from what chemotherapy has done to my body.
A multi-dimensional focus on all the aspects that make us up as people. So
Correct.
some toxic, substance for chemotherapy, which works to a degree,
To a degree.
there is this variability, and then of course in the very near future, specific genetic modifications and corrections will be individually made for people. That's already something that's available right now.
Correct.
But here's something, that's been here the entire time, and we got lied to and cheated out of, and then have to feel guilty about it and still risk incarceration. It's ridiculous.
Right. And I know many people who have. In fact, you're speaking to me in Denver, Colorado, and I've had to make a life choice in leaving home, which is Texas, just to be able to have access to this medicine. Because that's exactly what it is for me, is a medicine.
Yeah.
You know, people may look at it in a different form, and you may not understand it because of the stigma of what was given from the past. But that wasn't the whole story. That wasn't the whole story. And I believe that, sadly, the government knew that. That's why they have patents on cannabis. It is what it is.
Well, it's, I don't know how to explain it. It's like 9/11 or Kennedy, and I love to, talk about those subjects because I see them as the same type of thing, a deception for the purpose of some type of monetary gain by some entity that existed and or still exists. And now we've created the DEA, which wants to come in and deal with hemp crops.
Correct.
I mean, how much time can we waste with this fear tactic type of governing?
Right.
And that's really what it is. Create fear and the people will listen and follow.
Right.
And throw out enough propaganda and eventually they'll believe anything.
Right.
So you have to protect yourself not only from the toxic environment, but from the toxic information.
So when patients come to you, Mike, and they tell you, I have this problem or this situation, how do you know what to what to give them? What would be a standard of care, or do you just kind of?
It's simple, and I'm certainly not a well, I guess I am to a degree a medical doctor, but not like people would think of.
Correct.
So, I wouldn't want to put somebody in a situation where they were freaked out by something, as we were talking about the mushrooms before.
Right.
It's something you mentally prepare for, and also at a dosage level. It's just like working out. If you go to the gym the first day, you can't do what you're going to do 4 years from now, or even 4 months from now. So that's as simple as it is. I just try and start people off on a very
Low dose?
comfortable, and I don't think it takes a large dose. The
Right.
more you take is not the better you are. There is an amount that's enough, and that's all, and it's not more and more and more and more.
So if you find a dose, whether low grade, medium, high, don't matter. When you find something that works and makes the patient feel better depending on their diagnosis, then they stick with that.
Or you can tweak it, so you can change now all these, because we would have some CBG and we might have some Delta 8, and now we could formulate,
Nice.
a more complex medicine that deals with people on an individual level. Now, that's trial and error, but you're trying stuff that isn't ever going to kill you. And no matter what you do, even if you did feel paranoid and think somebody should take you to a hospital, you're actually physically enhanced by it.
Interesting.
So,
Yeah.
that's really the only part of it. Just is the getting over the stigma of it, getting over the propaganda that's been put into people, and then realizing there is a benefit, but it can also be something people aren't used to, a totally different way of feeling. People, if all you did was drink a 12-pack of beer for the last 20 years every day, this is going to be different.
Right.
And you're going to feel different about it. But, so it's a small dose. I don't think over 100 milligrams is or more than a single gram is anything anybody would ever need to, and you could divide that up throughout a day.
Right.
And really 25 milligrams of CBD or CBG or any of the other components or the combination of those, maybe to 50 milligrams is plenty.
Yeah.
And so it's a matter of just keeping it in your system more than it is, going really. Although the Rick Simpson, a gram a day of pure distillate THC is going to put you in a bed
Right.
and you're not going anywhere and doing
Right.
anything, but
Right.
a lot of that healing comes from that time that people spend calm and sedated, and it allows, just like your body does every night.
It allows it to heal itself. The body can heal itself. I keep saying that. Even, let's just say, I go back to nutrition, because you wouldn't understand what a role even nutrition played on my body. Prior to me getting diagnosed in 2014, I had a horrible diet, and I realize now what I did. I did the damage to my body, but I didn't realize that I was living in a toxic environment. And when I think back of what I did without holding myself accountable, and most people don't, because we're taught in society that everything that we are doing is fine and it is okay. When you think of a grocery store, and I was talking to Mike about this, why is it that organic food is more expensive than other food? There shouldn't be a difference, because it should be a choice. Why are we allowing things to come in that are or does harm the body? It shouldn't be cheaper and it's going to affect you in the long run. If that's the case, then we should put it out of our grocery stores, and we should use what is safe for our family, our children, because we're giving this to our kids, and they don't know any better. So the education starts with us in every which way.
And not just that, it's food, and you brought that up earlier in your career, and a lot of people, your exposure to toxins.
Correct.
That maybe there's regulations or it's unregulated, so there's a definite awareness that people have to have as individuals that maybe isn't emphasized enough in certain industries like hair and nails.
Correct.
Now you hear about all the pipe fitters and the mesothelioma and the guys who work with paint or whatever it is.
Right. And guys, I decided to do this video and speak to someone who was very knowledgeable. We reached out. In fact, this is the first time we actually are meeting in person. But I believe that the more education I give will open the minds to people to kind of think a different way. Don't judge, and you won't know until you actually know someone who's going through it. Now, saying that, I'm going to tell you that the #1 killer right now in the United States is cancer. It is 1 in every 3 Americans that will have cancer. Not maybe, it will happen. But a lot of it is because of our environment.
Yeah.
And again, we're not being told.
Just because this is extremely inexpensive, it could be free. It could take a little time and effort. It doesn't require an insurance policy to pay for it.
Correct.
And that's a full treatment. Does it, in a lot of people's mind, I think it devalues things when they don't cost anything or they're very cheap. Well, how could that be? Or how could this have existed all this time and we didn't know about it? Well, we did know about it for thousands of years.
Correct.
And we've been brainwashed for the last 80 years, and it's been a policy that the government had other intentions for and lumped this in there out of ignorance. And a lack of concern for the knowledge that already existed. It's not a new discovery.
No.
It's been known for thousands of years, and certainly for, since the 50s and the 60s.
Well, I tell people all the time, let's go back to the cowboys and Indians days, where there was no pharmaceuticals. What do you think the Indians were making? They used medicine, natural medicine, all plants, from mushrooms to, cannabis. And they physically made it just like you're seeing my friend Mike making this, in his own home, to give to patients that are in need. And it does help the body for many diagnoses, not just cancer.
No, for general living and essentially old age.
Correct. I understand.
Ease the pain of old age or sleep through the night. I probably got up 20 times last night and I haven't made the capsules or taken them for, I don't know, a week or two myself.
So then you feel the difference when you're not on it.
I notice that every single night.
Wow.
I have a prostate issue that completely goes away when I'll, for even up to 3 days from one single capsule of
Interesting.
CBD because of the anti-inflammatory.
Yes, and I've said this, every sickness and disease, it does not matter what sickness or illness you have. If you are sick with whatever, that's inflammation in the body. Cannabis is an anti-inflammatory, period.
Can't go wrong.
Hello guys, Jessica Bustamante back from Denver, Colorado. So as you saw, I did a video with Mike Nelson. There was so much to that video that we talked about back and forth, and I know a lot of you are probably going, well, there's some things I understood and there's some things I didn't. So I want to clarify some things. Number one, I will be working one-on-one with Mike when I get to Denver, Colorado. So you're going to be seeing a lot more of Mike Nelson and myself educating people on the medicinal purposes of cannabis. A lot of people don't understand, how cannabis can play a role in the body. I'm going to try to educate you on the differences of CBD versus THC versus half THC and half CBD. Now, what is legal in Texas? In Texas, only CBD is legal. THC is not. But in other parts of the country, they do have THC as medical use, and it is legal. Unfortunately, we live in a state where it's not. But that doesn't mean that there's not a purpose for it. In 2014, when I was diagnosed, in the beginning, I knew nothing of cancer. And I had an amazing friend, Jennifer Solis, who taught me a lot of what I know when it comes to cannabis. She had been fighting 5 years prior to 2014. We have different cancers. Hers was throat cancer. Mine is breast cancer. Hers was also a stage 4, and she was considered terminal. Here's the thing. Jennifer, 6.5 years later, okay, we're in 2020, she is still here with us today, 100% healed. You heard me, healed. And she treated herself, and still to this day, treats herself with medical cannabis. And I say medicinal medical because we don't do it for the high. Most people, when they think marijuana or cannabis, they think, oh, you smoke it. Normally people think high quantities of THC, which is not legal, is the way to go for a high. Well, neither one of us want a high. Number one, I taught my children no drugs growing up. I was a parent, and so was Jennifer. We were both parents who said no drugs to our children, not realizing what cannabis was. Truly, we were not educated at all. When I started my journey and Jennifer was 5 years in, they had cut her off and gave her a month to live. Jennifer was on an oxygen tank. She broke 3 ribs by coughing like this. Just like that. Okay? They emptied fluid from her lungs. And I was living with Jennifer in her home when all this was going on because I had my breast surgery in New Mexico. When she came home and told me, Jessica, the doctors just cut me off and they only gave me minimal time, I was like, what do you mean? I'm at the beginning. You're, 5 years in. If this is what they're going to do to me, in the future, and this is what I have to look forward to, this is not the kind of life that I wanted. Being a terminal patient, we want quality of life. In our case, never in a million years did we fathom or think that Jennifer could be 100% healed. Now, I have been treating myself as well for the last 6 years. Am I still battling today? Absolutely. But here's the thing. They only gave me 1 year to live. And when you sit here and you're looking at me speak to you, the quality of life that I've had has been amazing. Beyond amazing. Even for the doctors to believe. And I do believe with all my heart that medicinal cannabis played a big role in why I am the way that I am today. And Jennifer evidently is, living proof because she is healed and only treating herself with cannabis and nutrition, which is better diet. I've told you all that nutrition is key when you have any disease. Doesn't have to be just cancer. But here's the thing. If we don't talk about these topics, then how else are you going to know or ever learn about what else there is out there? I am determined to let people know that you can think for yourselves and there are things out there that will help the body. Okay? Not only has it helped me with pains, but it's helped me with eating, nutrition, have an appetite. Most patients who go through chemotherapy don't have much of an appetite because they're being torn down. And the body, it can only take so much. So by ingesting, and I do, and so does Jen, we do everything in oil form, okay, which gives healing to the body. What is cannabis? It is an anti-inflammatory. What is cancer? Inflammation in the body. Now, there's a lot more to this story. And for that reason, I'm going to educate you when I go to Denver on many topics, and I'll be working a lot with Mike to educate you, not only on how, to make cannabis, even in your kitchen, in your own home. That's how me and Jen started, but the benefits of what it did for my life and other patients' lives. Mike has treated over 2,000 patients in his time, okay, with different diagnoses, not just cancer, but many different diagnoses. You heard him speak of even age. As we age, our body slows down. You have aches and pains where you didn't have it before. It's helped even a normal body function better, have less pain, and even just have a better quality of life. It's not about the high, because not necessarily is stronger better. It's about finding the dose for your body and your diagnosis. So there's a lot that you're going to learn with us as you continue to follow me on this journey. So this is going to be one of many videos that I do with Mike Nelson. And I can't thank him enough from the bottom of my heart for educating not only myself, but others who are out there who need answers. So I just felt compelled to come out, start a video, and start from the beginning. So you're gonna see a lot more videos coming soon. So don't stop following. And remember, if you haven't purchased my book, go to www.cancervoid.com. Why? Because it's a guide to learning what I did different in my journey. Not only what I did different, but I share many things from, nutrition, spirituality. I talk about cannabis. I even mention Jennifer in my book so that you see not only my journey, but someone else's on what it did. And you know what? When it comes to your health, nobody should have the right to tell you what to do with your body. In my case, what did I have to lose? In Jen's case, what did she have to lose? And yet, we're both still here. So, continue following, guys, and thank you from the bottom of my heart, for following, for supporting, and for sharing my messages. Because without you, my message won't go far. But with you, I can make a difference, and so can you. Not only for myself, but for patients out there who are curious or don't believe that there's options, or maybe they just don't know. And maybe they're not given hope, like I wasn't, like Jen wasn't. Yet, we're still here. And as long as I still have breath in me, I will continue to educate. But I need you to share the message. God bless you all. Thank you. And I look forward to seeing you again on my next video. God bless you all.